welcome Dr. Sridhar, a clinical virologist from the University of Hong Kong, and Dr. David Lam, medical and health services sector lawmaker. Good morning to the both of you. And thanks for joining us on the program. Let's start with you, Dr. Sridhar. 2 COVID-19 cases with unknown sources recorded over the weekend. How worried should we be?
Yeah, it's definitely deteriorated in terms of the situation. I think last time I was on your show, I was exactly worried about this, that once you start seeing cases without a source, it's indicative that there are transmission chains in the community, and I think that's what is happening now. And I think we will see more of these cases cropping up over the next few days. So that's something that we have to be prepared for.
So is now the time to further tighten social distancing measures?
It kind of works like this. The later we do it, the more prolonged the local outbreak is going to be, because any measures that you put into place at the current moment, we'll only start seeing an effect of those measures about 1 or 2 incubation periods later, which is a week or more later. So the later you put them off, the more likely it is that we're going to have a protracted, prolonged outbreak in Hong Kong, which I think doesn't align with the government's intentions of opening the border with the mainland. So I think what we're going to be seeing is a further tightening of the screws before very long, including school closures, which is definitely on the cards, and it's been one of the measures of the outbreak playbook that the government has been using all along. So I think we're going to be seeing more measures before very long.
Dr. Sridhar, good morning.
Morning.
It's Monday again, it's COVID again, and it's you and me again. At what point, I just noticed all the overnight closures where the buildings were, everyone was tested. Once again, it's a complete negative. At what point should we just test the whole community?
Oh, right. That's a major undertaking. It's something that the mainland actually regularly does in terms of very, very extensive testing, far beyond the building itself. But, I would still question the value of that at this stage, in that you're going to be doing a lot of PCR testing, which is fairly expensive, quite expensive per sample. And I would think at this stage of community transmission that we're at, you're not going to be picking up a lot of new cases. So the cost effectiveness of that exercise at this stage is probably questionable.
Right. So we're not there yet, you think?
I don't think we're there yet. We've never been there with Hong Kong, even with much more transmission than we're seeing at the moment. So I think the best thing we can do is really focus on specific high-risk groups that we've been identifying all along in Hong Kong. For example, taxi drivers and restaurant staff are particularly high risk, and we should offer additional testing to this population, because they kind of tend to be the bellwethers of how bad things are in the community in terms of silent transmission, and I think we do owe it to them as well to offer more testing to them.
All right, let's now bring in Dr. Lam. The government said it will review the current anti-COVID measures later this week, but looking at the current developments, do you think social distancing measures should be tightened now? I mean, earlier, Dr. Sridhar, he said the closing of schools is on the card.
Well, it is not only social distancing measures, but also the vaccine passport, the vaccine bubble that we have been talking about. The whole idea is that people who are vaccinated, even if they get infected, they get a much milder disease with much lower chance of going into ICU and dying from it. Therefore, I think vaccination bubble is one of the most important things we have to push for. Now, we still have a relatively low vaccination rate in Hong Kong, particularly among the elderly. If you look at the figures, those above 80 got about only 20% vaccinated, which is very, very low. And this is the particular group who will be most vulnerable to having severe disease or even mortality in case they get infected. Therefore, this is one thing we have to push for, rather than just more and more social distancing measures. Another group that we have not been doing a lot are the children. Now, the vaccination is down to 12-year-old, despite the fact that late November, which is about 50 days earlier, the government has already approved to extend the eligibility of using CoronaVac to children down to 3-year-old. It has not yet been implemented. So we are actually pushing, and I have already prepared a letter which will be sent to the Secretary for Food and Health today to ask for an immediate implementation of vaccination to young children. So these are some measures we can do.
Right. Dr. Lam, I'm entirely with you on this low vaccination rate. We're lower than the mainland, we're lower than Taiwan, we're lower than Macau. We're the lowest part of China in terms of vaccination rate. And yet recently we did actually see people queuing because of the message that you can only go to a restaurant if you had at least one jab. And so we know what pushes people to get vaccinated. Why aren't we taking a much tougher line with this?
Well, you can see that people are not really against vaccination. Most of us are just waiting to wait and see. And we also see on the internet a lot of anti-vaxxers still pushing how bad vaccine can be. I think that should be condemned and contained. Otherwise, I think we would have a better uptake of vaccines.
Right, but when we announced the stiff measures were coming in, people started queuing, especially elderly people, and then we immediately said, oh, well, we'll relax them. We only started after the 24th of February.
Yes, that's a little late. That is a little late. And we must understand that we do not get protected day one after vaccination.
Right.
It takes at least 7 to 14 days after the second dose before you have the highest level of antibody. So that takes time.
Yes.
So to tighten the vaccine bubble now, we'll only have a portion of us who have been vaccinated long enough for the antibody to rise and T cells to be activated. Yeah. But then we still have to do it. And the government is trying to open at least 2 more vaccination centers. And I understand there might be more than that.
Dr. Strider, Dr. Lam here, he's saying, he's pointing out the importance of vaccine passports, vaccine bubbles. But right now with COVID-19 cases and some Omicron cases in the community, what's the point of this vaccine bubble and vaccine passport? Is there any point to it?
I think you raise a fair point for the simple fact that with Omicron, it's really the third dose that's the charm, right? So because the third dose, we know by now, significantly improves people's protection against catching COVID-19 and even protecting them against severe COVID-19. 2 doses are still fairly good for protecting you against more severe forms of COVID-19, although it might not protect you at all from catching COVID-19. 1 dose probably doesn't do much. So the problem is we're now running out of time. We are seeing an Omicron outbreak in the community. It's important to push vaccination for sure, but it's not going to save us in the short term because you need time to deploy those 3 doses to a fairly vaccine-hesitant elderly population in Hong Kong. So what do? We need a plan B, right? And we need a plan B that plays to Hong Kong's strengths, which is being very rich and secondly, having a fairly prodigious capacity to hunt down cases in the community. And why I say that is we need to look at our hospitals and how to shore up our capacity for a tsunami of cases, many of which might potentially be very severe. And we have to do that by investing in some very new antivirals that have come out into the market, and also older antivirals that have been shown to protect against severe COVID-19 if you give them early in disease. So we've got to focus on detecting cases as soon as possible, giving them the appropriate antivirals to make sure that they don't progress to severe COVID-19, not only for their own health sake, but also to make sure that we don't overwhelm our ICU capacity. So I think we're at a point where we have to say, okay, our vaccination campaign hasn't gone as we planned. We still have to push vaccination to the elderly for sure, but we need a plan B to make sure that they're safe over this. Some countries
in Europe have told elderly people, you've got to stay home. If you're not vaccinated, you have to stay home.
Oh, absolutely. I mean, that is something that we might also have to see. But what I will say is this. In my opinion, very selective measures aimed at a particular segment of the population, for example, the elderly, are not going to work in Hong Kong because the population is so dense. You have a lot of interaction between different segments of the community. You have, even your home might not be the safest place. We repeatedly see that latest in the building in Tai Po, right? You still get transmission in the building itself. So for these factors, it's very difficult to cut off a particular segment of the population. And even in the West, the story is usually that outbreaks begin in the younger, more mobile segments of the population and eventually filter out into the elderly population where it causes the most damage. And I'm sure we're going to see the same in Hong Kong. So we need a plan B to protect our unvaccinated, under-vaccinated elderly.
And Dr. Sridhar, earlier you said the closing of schools is on the card. Do you know when that might happen? I mean, looking at the current development. And also, many parents I've spoken to, they don't want class suspension because of the impact it would have on their children's physical and mental health. Is there a middle ground? Can we shorten the time kids spend at school? Is that enough to minimize the spread of COVID?
I entirely agree. I mean, school closures should be the last thing we're doing. But unfortunately, it is one measure that reduces a lot of social movements per se, and it also reduces people gathering in crowded indoor facilities. It's something that's been used historically for control of flu and COVID-19 outbreaks in Hong Kong. And it's one of the go-to measures that will come into play because the government is so keen on zero COVID and getting things back down to under control as soon as possible. That is, as much as I don't like it, is one of the things that is on the cards, yeah, for sure. But I don't know when that'll be. But as I said, the more you delay it, the less efficacious it's going to be because you're going to have a lot more cases by then and it's going to take longer to bring it down to zero. So if anything, these kind of measures will be brought into effect earlier and later.
I've got two emails here. This one is from Simon. He says, closing schools would be a massive mistake. Can the experts tell us just how many kids in schools have been involved in transmission? Children's futures are already at risk as they have been on half days for more than 2 years. How long do we keep using this playbook? For 5 years, 10 years? It's a disgrace that the government has no long-term plan. And I've got another email here. It says, I would accept my child having to miss school again if it was for 1 month while a vaccine mandate came in and all adults in the city had to be vaccinated. We have to stop harming children. We know that not allowing them to go to school or to play outdoors is harming them. They have done their part for the past 2 years. It's time for the adults and elderly to step up and do their part. I think it's the turn of the unvaccinated to stay home rather than children. Dr. Sridhar?
Entirely agree. Those are great points. I entirely agree. And in fact, in many parts of the West, I would say there is no longer any justification for keeping children away from school unless things are very, very severe in the community, as they are in some parts of the world with Omicron now. But unfortunately, it is the current state of limbo that we're in, of having a very, very under-vaccinated elderly population, as well as having a zero-COVID policy that makes harsh social distancing a reality if things get worse in the community. So this is not a long-term solution. It is not sustainable. I think most local experts are on the same page now, that this can't be kept up forever. We need a better plan. We need, if the vaccination campaign is not working for the moment, as I said, we need a plan B to protect our elderly and the healthcare system. And that would rely perhaps on some of the newer antivirals that's coming out.
And in the earlier email, Simon, he wanted to ask experts to tell us how many kids in schools have been involved in transmission. According to what I've been reading, it's around 2, is it? Like 1 in a kindergarten and 1 in a primary school, Dr. Sridhar?
Actually, I'm not sure about the entire figure. There have been multiple instances of children testing positive, absolutely. And that has, in some cases, led to school closures. But offhand, I don't recall how many were actually involved in transmission. The extent to which it's happened in the past is not an indicator to what might happen in the future, especially as variants get more and more transmissible. So Omicron is certainly the most transmissible one we have in Hong Kong. We've had in Hong Kong to date. And as might be expected, especially for primary school, you're talking about basically an unvaccinated indoor setting, and that's something to. It's not an insubstantial risk. I mean, that's the reality of it. It's an indoor setting, variable ventilation, unvaccinated children gathering closely together. You could have transmission there. So that unfortunately is the reason why they're the first targets to get.
I'd like to put this to Dr. Lam as well. Dr. Lam, we've made our young children carry the load for 2 years now, and all because of a reluctance to get tough with the elderly. This is not fair intergenerationally, is it?
You can't really say that. I understand that we do not have a good vaccination rate, and we pick up rather slowly. But at least to start with, before we have the vaccine, closing school was one of the measures that keep our children safer. So we can't put all the blames on the people not going to vaccine. But today, of course, the situation is a bit different. If everyone who is eligible for vaccination get themselves vaccinated, I believe we do have a safer environment for schools to continue. Now, back to the numbers, at least there is one 3-year-old kindergarten kid who is infected, and his close contacts, meaning his classmates, has to be isolated. Now, just imagine the hassle you are facing if you are a parent that your child, a 3-4-year-old toddler, has to be isolated. And when there are tens or even later on more of them, that is going to cause a big problem. So instead of having to isolate these children, why not we just consider closing kindergarten at least early on before the outbreak sets in? I'm not saying we are closing secondary school, especially when school children are vaccinated above 12-year-old. So I think we have to consider all the options and get ourselves prepared for a school closure. Now, there are also other schools suspending classes because of children or their contacts have been quarantined. So it is not something that has not happened. It is happening.
All right. So if small children have to be isolated, presumably a parent would have to go with them.
I believe so. I believe so.
So we're taking more people out of the world. Yes.
So instead of going there, why not we just close or suspend classes of kindergarten earlier on?
Or make vaccination mandatory.
You can do it down to 3-year-old. Vaccination. Mandatory, yes. Mandatory meaning if you do not get vaccinated, you can't go to many places.
Right.
Or you can't even get onto public transportation. That's right. The entire thing, yes.
And apart from this possible school closure and apart from the 2 COVID cases with unknown sources recorded over the weekend, what many people are interested in is the latest development in the birthday party cluster, where a woman who tagged along to the party with her friend has been confirmed to be a preliminary positive case, and there are several others who, like her, tagged along with their friends who were invited to the party. Dr. Lam, how worrying is this latest development?
Well, do not just finger point at one particular party. Since the turn of the year, doctors and nurses and all medical and health professionals have been very worried that the outbreak seems inevitable, and we have been calling people to avoid gathering. Party is one, definitely. And if you get onto the street yesterday with the Sunday, you still see a lot of gathering in restaurants. There's a lot of shopping mall goers, and again we see our good tradition of domestic helpers gathering in places in parks and footbridges, and that is something we have to avoid as much as possible. I am really worried that after yesterday's gathering we might see another surge of cases. So yes, definitely we are against gathering in this particular moment in time. Try to restrain ourselves for maybe 2 or 3 weeks, and we hope things will get better.
Doesn't that make the performance last week even more serious? The things you're saying are common sense things.
Yeah, things are changing very rapidly. The general sentiment on the 3rd of January and today can be quite different, although doctors do have a slightly earlier warning of those things going on. Now, but if you talk about the particular meeting or party, there are some people, at least on the photos, that they were not wearing masks. And I think that is something we have to be very careful about. At that moment in time, gathering in restaurants and parties are still allowed by law. So I doubt very much if anyone has contravened any laws. But then not to use face masks except during eating and drinking is supposed to be forbidden. Yes, there's something that we have to look at.
Are there limits on the venue? There used to be limits on how many people you could bring to a wedding.
240.
240 to a wedding, but this wasn't a wedding, was it? Is it the same for birthdays?
I don't think the government specifically mentioned birthday, but gathering in restaurants.
But
We sometimes have, well, what about New Year Eve parties? You still have New Year Eve party, not wedding, but you still have many tables around. So it is actually not specifically for only wedding, actually.
But Dr. Lam, do you think that this incident will make the government's anti-epidemic work more difficult?
Sorry again.
Do you think this incident, this birthday party, will make the government's anti-epidemic work more difficult?
Yes and no. Yes, in terms it sets a bad example for the public. And no, because the main people who implement the policy are not there.
But there are other officials there, right? Do you think it'll be more difficult for people to listen to the advice from the government on health issues? Will they still be willing to?
That's why I say it is a bad example. And I believe these people have learned a good lesson.
And some people have said that a probe should be carried out by maybe the police to restore residents' trust in public health rules. What do you think of that idea?
Well, I think there should be investigation into whether anyone has breached any particular law during that incident and other incidents as well. But I do not think we should be just finger pointing on one particular party when we have gatherings around in the city, and also the spreading of cases under the surface, which is more important than a single incident.
All right, we have to take a short break for the news summary. Dr. Lam, thanks again for joining us this morning. We have on the line